All right, today we're tackling a really fascinating medical paradox. It's a situation where the very treatment that's supposed to save a life can actually, for a little while, make someone feel absolutely terrible. So let's dive right in. So, picture this, right? You've got a patient with kidney failure. They go in for dialysis, which, is supposed to clean their blood and make them feel better. But then the opposite happens. Instead of relief, they get this splitting headache, they're confused, it just doesn't make sense. And for doctors, figuring out this puzzle is, well, it's absolutely critical. Well, it turns out this weird set of symptoms, it's not random at all. Nope, it's a very specific, very real condition, and the culprit has a name. Dialysis Disequilibrium Syndrome. DDS for short. So let's unpack what's really going on here.
So what is DDS really? When you boil it all down, it's about a super rapid change in pressure inside your skull. And the two key words you got to remember are temporary and pressure. See, during dialysis, something triggers a big fluid shift, and that causes the brain to swell up, just for a little while. To really get it, we need to zoom in and see what's happening at the molecular level.
Okay, so before any dialysis happens, a patient with kidney failure has a lot of waste products, like urea, built up in their system. But here's the thing, their body has had time to get used to it. So the amount of urea is pretty much balanced between the blood and the fluid that cushions the brain. Everything is, kind of in a stable, balanced state. And then the dialysis starts. And this process is, wow, it's incredibly good at its job. It just yanks all that urea out of the blood super fast. So the urea levels in the bloodstream just plummet. But, and this is the key part, the urea that's in the brain fluid, it can't get out nearly that fast. It's lagging way behind. And that creates this huge, sudden imbalance. So what you're left with is this really stark contrast. Right after treatment, you have super clean, low urea blood flowing right next to this brain fluid that's still packed with urea. You've gone from total balance to this massive, jarring imbalance. And, nature, it really doesn't like an imbalance. So how does nature try to fix this? Well, it uses a process you probably remember from high school biology, osmosis. It's a pretty simple rule, right? Water always wants to move from an area that's less concentrated to one that's more concentrated. It's just trying to even things out. So what does this mean for our patient? Well, the body sees this situation. It's got low urea blood on one side and high urea brain fluid on the other. And to fix that gap, water does exactly what osmosis tells it to do. It rushes out of the bloodstream and straight into the brain fluid, trying to dilute it and get things back to normal. But there's a huge problem. Your skull is basically a closed, rigid box. It can't stretch or expand. So when all this extra water comes flooding into the space around your brain, it has literally nowhere to go. And the immediate result is a sharp spike in what doctors call intracranial pressure. And this is where all that science connects right back to what the patient is actually feeling. That intense internal pressure, that's what's causing all those awful symptoms we talked about at the beginning. The headache, the nausea, the vomiting, the confusion. The patient is literally, physically feeling the effect of that massive, rapid fluid shift. Now, here's the good news. This whole thing is temporary, thankfully. If you give it a few hours, the body starts to catch up. The urea levels finally balance out, that water shift reverses itself, and the symptoms just go away on their own. But even though the symptoms of DDS disappear, they create a real headache for doctors, no pun intended. Think about it. A confused patient with a headache right after dialysis, that could be a lot of different things. So the challenge isn't just spotting DDS, it's being 100% sure it's not something much, much worse. And this is where the detective work, the diagnostic clues become so important. As you can see, DDS is caused by that fast urea shift, right? But other conditions, they have their own telltale signs. For instance, if a patient is high potassium because they missed a treatment, they'll usually have muscle weakness, not so much confusion. On the flip side, if their potassium is too low because dialysis was maybe a bit too aggressive, you'd see low blood pressure and a slow heart rate. Each one has its own little signature. But there's one look-alike condition that's especially dangerous. Out in the real world, it can be incredibly difficult to tell the difference between DDS and something called a subdural hematoma, which is a bleed in the brain. And dialysis patients are actually more likely to get those. So because the symptoms can look identical, getting the diagnosis right and right away is just absolutely critical. So let's bring this all together.
The crucial takeaway here is that dialysis disequilibrium syndrome is a total paradox. It's not a sign that the treatment is failing, not at all. In fact, it's a sign that the treatment is working too well, almost. It's so efficient and so fast that the very delicate balance inside the brain just can't keep up. And that kind of leaves us with a bigger, more philosophical question to think about, doesn't it? This whole syndrome is a perfect example of a new challenge in modern medicine. As our treatments get more and more powerful, better and better at fixing these huge problems, how do we get better at managing the delicate, sometimes strange, new problems that our own amazing solutions can create?